Big news in the pharma world. scPharma is being acquired in a Blackstone-backed deal. They're getting a cash payout plus a CVR kicker tied to FDA approval and 2026 sales. At-home heart failure care is saving money. But will a pharma giant swoop in to top the offer? Stay tuned for the latest updates.
Let's first talk about scPharma and then we'll get to the deal. scPharmaceuticals makes a drug called Furoscix, and it's a diuretic that's used for congestive heart failure or chronic kidney disease. When people have those diseases, they have what are called swelling incidents where they retain fluid and everything swells up and it's incredibly uncomfortable and can be dangerous. Prior to scPharma, the standard of care had been to hospitalize people or send them to an infusion center and give them an IV diuretic. That is extremely expensive and it's also dangerous. You go to a hospital, you're likely to end up with other diseases. And it's also uncomfortable. People don't like doing it. scPharma allows people to be treated at home and it saves CMS, that's the agency that administers Medicare, 75%. It is 1/4 the cost of sending somebody to the hospital. So this was an idea that was suggested by Dr. Paul Thompson. He's a member of the DKI Board of Advisors. He's a cardiologist. He was also the person who suggested Shockwave, where we got a 70% return in just a few months last year. But anyway, that's why we owned scPharmaceuticals. It was a huge position for us, more than a 10% position. And the merger premium or the acquisition premium was a 31% premium to Friday's closing price. The deal provides for $5.35 a share in cash, plus a contingent value right that's worth up to $1 a share. The contingent, that's hard to say. The contingent value right will be based on scPharma getting FDA approval for something called their autoinjector next year and annual revenue reaching $120 million by the end of 2026. So, I think you're going to get the full dollar per share, and that's why I think you're getting a full 31% premium. The takeover price, depending on where we bought in, was a 40 to 50% plus premium from our initial purchase price and average purchase price. DKI subscribers did really well. Your question was about the valuation, and I think it's kind of light. This was about 2.5 times next year's revenue for a company that's growing more than 100% this year. They grew more than 100% last year. Last quarter, the annual growth, again, more than 100%. Projected growth for next year is still more than 80%. So that to me seems kind of cheap. I think the probability that you get the full dollar on the CVR, that's the contingent value right, is very high, and the probability that like Johnson & Johnson, Boston Scientific, or Medtronic come back with a higher bid here, they could certainly pay 3, 4, 5 times revenue without stretching themselves. This is a small cap company. I think the probability of something like that is in the range of 5 to 10%. I was kind of surprised that management agreed to a deal this cheap, but I think part of it was just such a huge premium. This is also a stock that was trading below $2 earlier this year. And, the final acquisition price, I think, is going to be $6.35. So, they were getting more than triple where the stock was, just months ago. I think that makes it really hard for management to turn down a deal like this. But to me, if I were J&J, Boston Scientific, or Medtronic, I'd be taking a look at this one.
So 2 questions off that, and I'll start with one of them. Do you know do we know what the deal looks like? Is there a ROFR or right of first refusal where if there's another bid coming in, the current person acquiring has the right to try to match and or beat whoever's coming in?
Yeah, so when this deal was announced, the merger agreement hadn't come out yet. I actually need to take a look through it. So I'm not sure, but typically with things like this, if you are the acquiring company and you're offering the big merger premium, typically with something like this, you're just going to have like a big breakup fee. Which again is the kind of thing at 2.5 times revenue for a company growing more than 100% top line. It's the kind of thing that Johnson & Johnson could pay down easily. the value here, it's under $500 million. The valuation of the company is just a couple $100 million. So, any penalty price for that is easily
Right.
paid.
So one of the last questions, because I did biotech for a small stint in my career, and it can be complicated because there's a lot of FDA nomenclature, there's a lot of different approval processes, different phases. But one of the big issues which could create some of the discount is that the company that's being acquired has the right to the drug, but doesn't have the sales force, the distribution, the manufacturing, which are all very expensive to do and would require additional capex, whether that be from an equity raise, whether that be from a debt raise. Is that something that could weigh on the premium that they get because the acquiring company is going to have to either restructure some of their manufacturing or build out new manufacturing to deliver this to market?
Yeah, great question. So first of all, the manufacturing isn't an issue because that's outsourced for this company. scPharma last year ended up getting some approvals that they were hoping for, and they increased their sales force. So they actually have a much larger sales force that's just starting to produce results within the last quarter. And also in the first quarter of this year, they got the approval for CKD, that's chronic kidney disease, and for class 4 CHF, that's congestive heart failure patients. So there's still a ton of growth here, but certainly, a company with an existing sales force can benefit from. And again, that's one of the reasons why I suggested, a larger company like a Johnson Johnson or Boston Scientific might be interested. They already have the sales force. They're already talking to these people. But, it's one of the things that's exciting about the company. There's a lot of growth that they have access to simply because, they've just gotten all of these new indications that they can sell into, and they've just added additional people to the sales force.
So before we go to my favorite comments and questions about steel demand in the US, one last piece. So when you're looking at this drug, so for those that don't know, if the FDA is one of the hardest places to get approved. So if you usually get approval in the FDA, you'll get fast tracked in other countries. There's even other countries that have reciprocity where if you have FDA approval here, you can quickly move into other regions. But a lot of times there'll be other drugs that could be, or other equipment that is competitive, but they don't have FDA approval, but they're used in Europe, they're used in India, Latin America. Is there anything that would be a hindrance for them expanding into other nations, other regions, or is this something that could be adopted quickly as you look into a global distribution?
It would be super easy to do. The fact is that, first of all, these are diseases that are worldwide issues. And you're talking about a diuretic, right? There's really nothing special about a diuretic. The key point on it is that scPharma's solution allows people to be treated at home. And you can say, well, wait, why is that a big deal? And it has to do with the pH level of the existing standard of treatment. So the current standard of treatment has a pH level that has to be delivered. It can't be delivered subcutaneously. It has to be delivered intravenously. That's why you have to send people to the hospital or to an infusion center. What scPharma did is they found a way to formulate a more neutral solution where people could take it subcutaneously. And so if any of you have ever seen somebody who has, or if you have diabetes, there's people, they have like the insulin pumps. It's like a little box, maybe smaller than a deck of cards that they wear on their skin with a small needle on it, and it delivers that insulin throughout the day. What scPharma has is something that looks very much like that and delivers over about 5 hours and allows people to stay at home where it's safer and they're more comfortable. Now, the autoinjector we talked about is incredible technology because that allows the drug to be delivered pretty much instantly. It would take about 5 or 10 seconds. And so they would just, apply it like to their belly and push a lever, and the drug would be delivered, and the diuretic would work over a multi-hour period. And so we're just talking about something that's really simple to use. But I don't think this isn't like cancer where treatment is very complicated and regionally based. It's a diuretic. The solution for scPharma isn't that we've reinvented the diuretic, it's that it's the delivery mechanism that makes it different.
Yeah. I mean, and that's always big when you're looking at the adoption because typically everyone wants the lowest cost solution. So if it's something that is faster, cheaper, easier, and better results, I mean, it's something that'll get adopted rapidly, especially when you look abroad.